September 1905. Teddy Roosevelt was in the White House. Albert Einstein had just presented a paper on something called the theory of relativity. And at Creighton University, founder and benefactor John C. Creighton added a college of pharmacy to the university that bore his family's name.
It all started 100 years ago in September 1905 when the Omaha College of Pharmacy became the Creighton College of Pharmacy. And back then, they offered a 48-week course of study for a PhD degree, or a graduate in pharmacy degree, which was changed over the years to a PhD. That was expanded to a 2-year course of study, all the way up to 1979, when we had a 6-year Doctor of Pharmacy curriculum.
The new school was located in the Edward Creighton Institute on 18th Street in downtown Omaha. In return for his teaching, his fixtures and stock, the previous proprietor got 40% of the school's gross receipts for 5 years. The College of Pharmacy joined those of medicine, law, and dentistry. Creighton was committed to infuse Jesuit values into health sciences education. Creighton's School of Pharmacy has always been on the cutting edge. From the beginning, the school has attracted and accepted a significant number of women students. In 1907, the College of Pharmacy moved to a 3-story building adjoining the medical school on 14th and Davenport, a facility considered state-of-the-art. The model pharmacopoeia contained such modern medicines as superrich acid, paregoric opium, ipecac, belladonna, mercury, and hemlock.
We had come off of a period where there was quite a bit of charlatanism in medicine. Actually, most of the drugs that were in use in 1940 were of little benefit at all. Now, the antibiotics were beginning to come in. Penicillin and a couple other of the early antibiotics were available by then. And so there was this mixture of things that were very effective and very potent, along with a lot of stuff that, that just tasted like medicine.
The role of the pharmacist was changing rapidly, and Creighton's College of Pharmacy was changing too.
I was there from 56 to 69 when we had to get out because the interstate was going to come through. So at that point we moved up to the main campus, and we were housed in a little duplex. I think that we took over from the philosophy department. And we were there from 69 to 1976, when we finally moved into Chris 3. Our enrollment was very small when we were downtown, 14th and Davenport. I think mainly because students wanted to be on campus. Once we moved up to the campus, the enrollment jumped.
Creighton's leadership recognized that pharmacists needed to take an active role in directing patients' health care, and that technology was revolutionizing the profession.
Computers can tell you, detect drug interactions that they might encounter occasionally. It's easy for them to arrive at a price. Again, before they had to figure out a price, now prices were set.
Today's students enjoy being partners in their patients' recovery and long-term health maintenance.
Patients will go to 2 or 3, 4 different doctors, and it's really important for somebody to analyze their meds and make sure that they are getting the right drugs and there's not duplicate therapy. Just the other day at work, we had a patient come in, was on a clonidine patch and was taking clonidine tablets. One doctor prescribed one of each. And so, me and the pharmacist, we looked over the profile and decided, they weren't obviously supposed to be on those 2, so we called the doctors up and they're very grateful for that. And that's kind of caring and the direction that you want Our patient was very grateful for us that we were able to point out these 2 different meds that she should have only been on 1.
The school broadened its scope when it added other professions, including occupational and physical therapy programs. It soon chalked up an impressive list of firsts.
In 1992, our entry-level Doctor of Physical Therapy was initiated, and Creighton University became the first university to offer that doctoral degree in physical therapy. And then in 1999, the Doctor of Occupational Therapy became the sole entry-level degree for occupational therapists, and Creighton was the first in that, to offer that degree also.
These disciplines respond to both the physical and emotional needs of today's patients.
The importance is that it speaks to the quality of life and getting people back involved in society and getting them back to work and getting them to participate fully in those activities that satisfy them.
It ranges from womb to tomb, if you will. There are huge increases in the numbers of physical therapists participating in women's health initiatives, in early childhood interventions, in sports medicine and athletics for youth, for young adults and middle-aged individuals as they begin to show the signs of wear and tear and injury, and finally into the elder years when we are most concerned for fairness and equity in a society.
It is the hands-on involvement with patients that motivates many students.
A lot of our treatment is based on who they are as patients, not just what they come in with, whether it's a bad shoulder or bad back or whatnot. It's also based on their culture, their religion, all the social aspects that they deal with also.
I heard about occupational therapy and how creative it is and how many opportunities there are, and it's such an ever-changing profession that I felt like it fit more with my personality and also gave me the patient interaction that I wanted.
You can't be effective as a health professional, any kind of health professional. I don't care if you're a pharmacist or a physician or an occupational therapist or a physical therapist, if you can't relate and communicate with a patient.
With all the changes, Jesuit values remain the cornerstone of the school's teaching.
We want to serve, whether it be in our professional life or in our social lives. Students at Creighton want to serve, and Creighton makes that option available to us.
There's a lot of people out there that, are on the lower level of the socioeconomic scale, and I feel like we're able to provide fabulous care and a lot of expertise to people that may not be able to gain that in other places, at other facilities, that may be turned away at other facilities.
With so many demands on today's healthcare professionals, Creighton prepares them with a multidisciplinary approach to teaching.
In the ICU setting, we model our services after the Society of Critical Care Medicine, where we have a multidisciplinary input to the care of our patients. This includes input from physicians, pharmacists, nurses, and respiratory therapists. And in this setting, students are exposed to challenging medically ill, critically ill, and trauma patients. And pharmacy students have a lot of input into the care of those patients.
This rich learning experience isn't just found on campus.
I found out about the web-based program from my uncle, who's an alumni of the dental school at Creighton. And he'd had a wonderful experience in Creighton and had read it about the program in one of their alumni letters and encouraged me to investigate it. So I was impressed and applied and was accepted, and it worked out well for me. My husband still had a year of undergraduate work, and so I needed to be able to be mobile because we knew we were going to be moving for his post-professional education. So that worked out great for me because I was able to stay in our home state and work on the web-based, and then was free to go wherever he got in. And just so happened he applied to pharmacy school as well and was accepted to Creighton, which was my first choice.
When today's students leave Creighton, they'll have far more choices than they did a few years ago.
Pharmacy has a gigantic array of professional opportunities. Pediatrics, oncology or cancer, pain management, adult care, nutritional support, pharmacokinetics, which is the study and the recommendations of drugs at particular dosage levels to get a good therapeutic effect and no side effects.
And they'll be well prepared by faculty members who combine outstanding clinical experience with academic knowledge and a strong commitment to each student's progress, professionally and personally.
the faculty in the physical therapy department and you know, throughout Creighton University, with at least the part that I was associated with, were all phenomenal.
I'd say the majority of the faculty have somewhere in the neighborhood of 8 to 15 or plus years of clinical experience, and now are academicians. They're helping to create policy, not just react to policy.
I must say that I'm extremely proud of the accomplishments of our faculty across the board. They're outstanding individuals in their contributions to patient care, to education, and certainly to scholarship, which would include research in its many forms.
As far as it's come over 100 years, the School of Pharmacy and Health Professions is poised to go even farther.
Creighton has been on the cutting edge of education, scholarship, and research for many years. Most recently, our distance education program in the pharmacy pathway has graduated its first class, in fact, in May of this year. So we had a centennial graduating class of these distance students, the first class of its kind in the United States. And that really focuses in on the success that we've had in our school in educational technology. Our vision of the future is, interestingly enough, has been described in our strategic plan most recently. And that vision asks us to be nationally prominent in our clinical programs in our school. And that's what we intend to do. And in order to do that, of course, we have to meet the demands of healthcare, we have to meet the demands of the patients, and we have to certainly meet the educational demands placed upon our students. We've done that very well in the past 100 years. We're doing better now than we ever have, and we're going to continue that process in the next 100 years.
The need for highly educated, ethical, and caring healthcare professionals has never been greater, and they will come from the Creighton University School of Pharmacy and Health Professions.